Welcome back, everyone. You know, plastic surgery for men is becoming more and more popular. So this Father's Day, why don't you take care of Dad by introducing him to the services that can make him look and feel a whole lot better. Joining me now is Dr. James Knoetgen. He's a certified plastic surgeon at Beautologie Cosmetic Surgery and Med Spa. I hear so much about you. Doctor, thank you for being here.
Oh, thanks for having me.
All right. We were talking about how more men are becoming more comfortable with plastic surgery and other things to improve their look.
Yeah, that's absolutely true. It seems like plastic surgery, cosmetic surgery has sort of lost its stigma, so we see a lot more men coming in for a wide variety of procedures, surgical as well as non-surgical procedures, definitely a lot more popular.
Well, good. I'm glad to hear that because the better you feel, or the better you look, the better you feel. I truly believe that. So this would make a great Father's Day gift for anybody.
Yes.
Let's talk about some of the, first of all, non-surgical procedures, like the injectables. You call it Brotox, which I love.
That's right. Botox for men, they call it Brotox, and it's becoming very, very popular. It's a very quick procedure, obviously. It's great for reducing little lines and wrinkles, and a lot of men are starting to move towards that.
Now, at what age do you think men should start thinking about Brotox?
You know, it completely depends on, you know, what their lines and wrinkles look like. If they have fine lines, fine wrinkles, I certainly don't push them into that, but if they start to get a little bit stronger and noticeable, and if it starts to bother them, like some of the photos you're looking at now, then, you know, then it's definitely a good time to think about it.
That's a before and after picture, and it's pretty amazing.
Yeah,
it's
it works.
Very amazing what it can do. It's very powerful. It doesn't hurt, and it's instant, isn't it?
Yes, it's in and out, 10 minutes over their lunch break, and they're back to work.
Wow. Okay, let's talk about breast reduction for men.
Yes. So that's actually a pretty common procedure. One of the 5 most common procedures for men. Sometimes just genetically or with time, men can develop a lot of breast tissue, even if they lead a healthy lifestyle. So sometimes a little liposuction or even a little skin removal can be very helpful. We see it in even teenage men, and then as well as older men, and it's a pretty popular procedure.
And this person looks to be in pretty good shape, and still,
Exactly. He's in great shape to begin with, but he does have just a little breast tissue there, and diet and exercise is not going to get rid of breast tissue. Diet and exercise will burn fat and tone muscle, certainly, but not get rid of breast tissue, so that has to be surgically removed.
Wow, that after picture really makes a difference. Okay, lipo for men as well. Now, when you say lipo, are you talking right here in the stomach area?
Yeah, definitely. The flanks and the abdomen are definitely the most popular areas. So a lot of guys, even though they have a healthy lifestyle, they're working out, sometimes they have these stubborn areas, like in that photo right there. And just a little liposuction can really make a dramatic difference.
Wow, that's the after picture there?
Yes.
That is pretty darn amazing. Talk to us about the procedure here and the recovery time.
So this is a 1-hour procedure done under general anesthesia. It's very safe that way. The recovery is probably about 5 to 7 days off work, and then about a month off of any exercise or heavy lifting. There's a little bruising and swelling afterwards, but we help them take care of that, and so the recovery tends to be pretty quick.
Is it just here in the sides, or is it the tummy area too?
Wherever they want, wherever the problem area is. It's not sort of a cookie cutter approach. They have to come in, have a consultation. We spend a lot of time talking to them about what their needs are, what their wants are. Then we do an exam, and then I talk to them about the pros and cons of doing it versus not doing it. You know, if they can treat it with a little more diet or exercise, I suggest that rather than having the surgery. But if they're kind of at if they're stuck, then sometimes the liposuction works.
And that's why giving us a price right now would be difficult, right? Because it changes for everybody.
It is, but usually it's a pretty quick procedure. It's about an hour to an hour and a half under general anesthesia, so it's not that much as a lot of other procedures, and it just depends on, you know, where they are and what they're looking for.
Okay, and speaking of the tummy area, people can get the tummy tucks as well.
Absolutely. We're seeing a lot more men getting tummy tucks because we're seeing a lot more men who are overweight to begin with, who then get a lap band procedure or a gastric bypass, and then they lose a lot of weight. So we see a lot of people who have lost 100, 200 pounds, and then even though they've lost the fat and their muscles are toned, they still have all this loose skin, and a lot of times you can't get rid of that with anything except surgery, and that's where a tummy tuck comes in.
These pictures, you could tell the difference.
Oh yeah, that's definitely the best way to treat that loose skin there. He lost a lot of weight. The only way to really treat that skin, because he exercises a lot, he eats really well, the only way to treat that is with a tummy tuck.
That's the after picture?
There it is, and you can hardly see a scar. It's hardly noticeable. It looks great.
Yeah, I can't even see a scar there. Okay, you also do tattoo removals.
We do a lot of tattoo removal.
Yeah, and I'm sure this is not just for men.
Exactly. No, it's men and women, but we do see a lot of men. I mean, tattoos are obviously very popular these days, but in some situations like gang tattoos, etc., you know, people want them removed, so we're definitely very happy to do that. and we have a lot of outreach programs, and we can remove a lot of tattoos that people got when they were younger, and now they just want to get rid of. So a lot of these are just laser tattoo removals, so they're outpatient, non-surgical procedures, and they can be very helpful.
Wow, you can't even tell this person had a tattoo before, because a lot of times you can still see
the residual pigment in the skin, and it depends on what type of tattoo they had, what type of ink, but there's a lot of different lasers and techniques we can use, so it's good for people to come in, talk about their options, and we give them the best option for them.
And that procedure, I'm sure, takes a little bit longer?
Sometimes it takes several procedures, so you have to spread them out over several weeks, and it can be a little bit longer, but it can be worth it in the long run.
All right, so you also do body contouring as well for men.
Yes.
How different is that from the other procedures?
Well, basically, body contouring kind of implies everything. So it's the gynecomastia, the liposuction, then sometimes with people who lose a lot of weight, they have thigh lifts or arm lifts. Yeah. A lot of people lose weight, and even though they tone their arms and the muscles are toned, there's still loose skin, so you can tighten the skin on the arm. So that kind of includes everything in total.
I love that. Okay, so if people want to go in for a consultation because they need to do that before anything, especially if you want to get pricing on anything, so give them a call over at Beautologie. Their number is 559-476-4462. Where exactly are you located, Doctor?
We're located on Fur off of Herndon and Cedar.
Okay, that's easy enough. And you can also visit them online at Beautologie.com. Beautologie.com. Ask for Dr. James Knoetgen. Did I say that correctly?
Yes, you did.
All right. It's good to have you here.
Thanks so much,
I love talking about men and body contouring and everything, because I think that, like I said, if they look good, they feel good.
You're right.
Yes.
I agree.
Thank you so much for being here. We'll see you next time.
Well, thank you.
All right. Still to come here in Central Valley today, why our Valley officers will be running down Blackstone next week. I'm going to give you hints. It's all part of the law enforcement torch run, what they're bringing awareness to. We'll have that when we return.